dear students, I am Dr. Pratyusha. We have already learnt about allergic rhinitis and vasomotor rhinitis. In this video, let us learn a small subset of various other types of non-allergic rhinitis. Now please understand that the nasal mucosa responds to various types of stimuli by producing symptoms of rhinitis. They are all neither infective nor allergic. They belong to another different category that we call as non-allergic rhinitis. So some of them under non-allergic rhinitis, they have special names and they have been discussed in detail. Let us learn about a few of them. It's a very easy, simple to understand topic. Please listen to it with attention and you will get it done once and for all. We have a couple of them. Each one named according to the cause or that particular situation. So first among them is drug-induced rhinitis. What is drug-induced rhinitis? This rhinitis occurs as an adverse effect of some other drug that is being used for some other purpose. For example, antihypertensives such as methyl-dopa, reserpine, guanethidine, propranolol also, they are all sympathetic blocking agents. And when we use a parasympathomimetic or sympathetic blocking drug, that will result in nasal stuffiness. The patient, repeat, the person always feels that the nose is blocked and it is full. Patient experiences nasal stuffiness. And as I just told you, not only sympathetic blocking drugs, even parasympathomimetic, for example, anticholinesterase. What happens when you give anticholinesterase? Acetylcholine doesn't get broken down, so its levels will increase. That will also cause nasal obstruction and stuffiness. What is? Can you give me an example for anticholinesterase drugs? Neostigmine, yes. Where is neostigmine used? It's used in the treatment of myasthenia gravis. So drugs like that will also cause nasal stuffiness. Another important category is contraceptive pills. Contraceptive pills also cause rhinitis-like symptoms because of estrogen effect. So what are the three categories of drugs that you have to remember here? One is anticholinesterase. For example, neostigmine. Second, sympathetic blocking drugs. For example, antihypertensives. And also contraceptive pills, oral contraceptive pills. These three you have to remember under drug-induced rhinitis. Now, apart from drug-induced rhinitis, there is another condition called as rhinitis medicamentosa. What is this rhinitis medicamentosa and how is it different from drug-induced rhinitis? Please pay attention and try to understand. Drug-induced rhinitis, we are using the drug for some other purpose elsewhere in the body. Yes. In rhinitis medicamentosa, topical decongestant drops are used, and these decongestant drops, upon prolonged usage, later on when they are stopped, discontinued, they cause a rebound phenomenon. Rebound rhinitis occurs. That is the reason these days we are avoiding decongestant drops in patients of allergic rhinitis, because they have to be used for a prolonged period, and once you stop the drug, it causes rebound rhinitis known as rhinitis medicamentosa. Excessive usage of nasal decongestants is the reason for this condition. So what should we do? When the patient has already been under nasal decongestants for a long time, before stopping the nasal decongestant, what we have to do is give a short course of steroid therapy. Under the cover of steroids, we have to discontinue nasal decongestants to prevent rhinitis medicamentosa. The treatment is a short course of steroids. So I hope you understood. Rhinitis medicamentosa occurs due to withdrawal of the nasal drops, nasal decongestant drops, whereas drug-induced rhinitis is as a side effect of some other drug used elsewhere in the body. Now let us move on to the next special type of rhinitis, and that is rhinitis of pregnancy. As you all know, during pregnancy, there is hormonal imbalance in the body. A variety of hormones are raising, certain levels are falling. Because of all these hormonal changes, certain women develop persistent rhinitis throughout pregnancy period. Their nasal mucosa becomes edematous, so much so that it can even cause nasal obstruction. And once nasal obstruction occurs, it can lead to secondary infections and even sinusitis. Proper infective rhinitis can later on occur because of prolonged blockage of the nose. Now, the most important point in rhinitis of pregnancy is when you are treating it, you should be extremely mindful about the you should be extremely mindful about the teratogenic effects of drugs because the woman is pregnant. We cannot prescribe just any antibiotic if at all infection occurs, and even for this non-infective, non-allergic rhinitis also, the prescription of drugs should be very, very careful. Generally, local therapy is given, topical therapy is encouraged, some nasal drops, topical steroids, and the woman should be put on other preventive measures so that the condition is not further aggravated, such as not getting exposed to cold temperature, regular steaming and all those things. That is rhinitis of pregnancy. What you must remember here is it occurs due to hormonal effect. Nasal mucosa gets edematous, leading to obstruction, and this can lead to secondary infections. Even sinusitis can occur. What you must remember is never prescribe drugs that are teratogenic, keeping in mind her pregnant condition. Is this clear? Okay. Next. Actually, I should have taught this before rhinitis of pregnancy, but okay, anyways. We have a condition called as honeymoon rhinitis. What is honeymoon rhinitis? Nasal stuffiness occurs following sexual excitement. In certain people that can happen. The nose can get stuffy and even rhinorrhea can occur before and during and after sexual intercourse. So that is honeymoon rhinitis. Nasal stuffiness. Associated with sexual excitement. Next in our list is emotional rhinitis. What is emotional rhinitis? In certain people, nose reacts to various emotional stimuli. Psychological states such as anxiety, hostility, depression, anger, resentment, grief, sorrow, all of them can result in rhinitis. Did you observe some people have perennial rhinitis all through the year? Every now and then they have episodes of rhinitis. It's neither infective nor allergic. It could be emotional rhinitis. That has become a defense mechanism in the body. Whenever they're emotionally upset or deranged, the nose starts to react and they have rhinitis-like symptoms. Now please differentiate this from the nasal discharge that we all have during crying. That is not emotional rhinitis. See, crying is also a type of emotional reaction, but that time the nose starts to have a discharge because all the lacrimal secretions are coming via the nasolacrimal duct into the nose, and that is why you are seeing a nasal discharge. That is not emotional rhinitis. I hope the difference is clear to you. Okay. So, how do we treat emotional rhinitis? Proper psychological counseling is required, and apart from that, there is a wonderful drug that we have called as imipramine. The speciality of imipramine is an antidepressant, plus it has an anticholinergic effect. As you all know, most of the antidepressant drugs have various types of adverse effects, and sometimes the adverse effects are actually beneficial to the patient. They are used in such a way that the patient gets benefited out of them. Like this imipramine, which is actually an antidepressant, has an anticholinergic effect. And this anticholinergic effect addresses the rhinitis part. So, we are treating the patient both for the psychological cause as well as for the rhinitis. Okay. Next in our list is rhinitis due to hypothyroidism. Now, thyroid hormone, what is the basic effect of thyroid hormone? It is sympathomimetic. And when thyroid hormones when thyroid hormone levels are reduced in the body, the patient is in a state of hypothyroidism. What happens is hypoactivity of the sympathetic system occurs, and there is dominance of parasympathetic activity. You have learned this in the beginning itself. Parasympathetic activity leads to nasal stuffiness. Remember, in drug-induced rhinitis, what we have learned? Parasympathetic dominance and sympathetic blocking. Both of them lead to rhinitis and nasal stuffiness. Anticholinesterase was what? It increases the parasympathetic activity. Sympathetic blocking will decrease sympathetic activity. And these are the major causes for rhinitis. So, in hypothyroidism, what's happening? There is decrease in sympathetic activity. Why there is decrease in sympathetic activity? Because of deficiency of thyroid hormone. So, your normal treatment of hypothyroidism, that is replacement therapy, when we are giving thyroxine to the patient, automatically relief will occur for rhinitis also. What you have to remember is, initially when a patient presents to you with hypothyroidism, they could be having this as one of their complaint. They say, doctor, of late I am having a common cold, every now and then my nose is having a discharge and I am having a running nose. Rhinitis will be one of the complaints, could be one of the complaints, okay. Yes, next in our list is gustatory rhinitis. What is gustatory rhinitis? Most of us might have experienced that at least once. When we eat spicy food or pungent food, that will result in nasal discharge. It produces rhinorrhea, nasal stuffiness. If it is too spicy and pungent, it can even cause lacrimation. Yes, sweating, flushing of the face, all of this will occur. That is gustatory rhinitis. Why will that occur? It is a cholinergic response of the body. When the sensory receptors on the palate are stimulated, it's a cholinergic response. To spicy food. That results in, what are the various symptoms? Rhinorrhea, nasal stuffiness, lacrimation, sweating, flushing of face, all of them can occur. It's more common in the pediatric age group actually, right? Okay, so it's usually avoided. We don't do anything about it, it just subsides within some time. But in some people, they're very, very sensitive. Even mild spicy food, if they eat, all this happens to them, and in case it's really affecting their palate and food and lifestyle, we can prescribe ipratropium bromide nasal spray. What's ipratropium bromide? It's an anticholinergic drug. So a few minutes before eating, if the patient takes ipratropium bromide spray, these symptoms will get subsided. Okay. Next in our list is a condition called as non-airflow rhinitis. What is this non-airflow rhinitis? What is the basic function of nose? To breathe in air. Sometimes that function is cut off. For example, when we do a tracheostomy, then all this apparatus becomes defunct and the air is going directly via the tracheostomy opening. Or in patients of laryngectomy also, the nose and its role becomes obsolete. It's not used for airflow anymore. But the nose is still there, it is intact. So what happens over a period of time is the turbinates of the nose, they get swollen because of loss of vasomotor control. When air is going in and out, vasomotor control occurs, and when there is no airflow, there is no vasomotor control, and that results in swelling of turbinates. And when the turbinates are swollen, it can result in rhinitis-like features. For any reason, not just laryngectomy and tracheostomy, I can give you a list where this occurs. After laryngectomy, in patients of tracheostomy, when else does the patient cannot breathe via the nose? Choanal atresia, adenoid hyperplasia. In adenoid hyperplasia also, children become mouth breathers, isn't it? Because not exactly in the nose, in the nasopharynx there is an obstruction, but that will make the nose almost obsolete for breathing. In all these conditions, rhinitis can occur. The problem with adenoid hyperplasia is not just this non-airflow rhinitis, because all the secretions and discharges are blocked there, stagnated there, that can even lead to infections. Because if not for the adenoid hypertrophy, the nasal discharge and secretions will freely go into the nasopharynx. Because of obstruction there, they are all getting stagnated, and that can result in infection also. So these are the various other types of rhinitis, special types of rhinitis. It's pretty simple, but nevertheless I'll revise it once for you. What you must remember is, when does rhinitis occur? Number 1, increase in parasympathetic activity. Number 2, decrease in sympathetic activity. That decides your treatment, and that also decides, you can predict when what is happening, if you remember just this one point. Drug-induced rhinitis, various drugs, side effects, rhinitis. One is your anticholinesterase drugs, which will increase the parasympathetic activity, antihypertensives, which will decrease the sympathetic activity, and also of course contraceptive pills. Then we have rhinitis medicamentosa, which occurs on prolonged usage of nasal decongestants, and withdrawal of nasal decongestants will result in rebound rhinitis. Next we have rhinitis of pregnancy. Because of the hormonal effect it occurs, please be mindful about the treatment. Then honeymoon rhinitis is nasal stuffiness associated with sexual excitement. Then we have emotional rhinitis. Important point about emotional rhinitis is, please remember imipramine. That's a good drug which has both antidepressant effect as well as anticholinergic effect. Then rhinitis due to hypothyroidism. Why? Because reduce in sympathetic activity. Gustatory rhinitis, that's a cholinergic response to spicy and pungent food. If it is really problematic to the patient, you can prescribe ipratropium bromide nasal spray few minutes before taking meals. Then we have non-airflow rhinitis, the last one. When the nose is not doing its function of airflow, the swelling of turbinates, repeat, the turbinates can get swollen and result in non-airflow rhinitis. Thank you very much.